Very good afternoon to all the viewers. This is Purnima Pandey, Assistant Professor at Dr. Viren Saroop Institute of Computer Studies, an institute that is a part of the biggest educational group in northern India, that is Dr. Viren Saroop Educational Foundation. With 22 years of establishment of professional institutes, it is proudly shaping lives and careers of around 4,000 students every year. Dr. Viren Saroop Institute of Computer Studies is a renowned name in the field of professional degree courses in Kanpur. Through its undergraduate and postgraduate programs in computers and management field, it is continuously setting benchmarks. Our BCA, BBA, MCA, and MBA courses are effectively blended with varied inputs to build a strong and skilled youth. Over the period, we have been organizing various forums and deliberations to ensure our students to get insight from erudite and experienced personalities across to guide and show them the right approach towards various facets of their lives. For this, it's my pleasure that on behalf of Dr. Viren Saroop Institute of Computer Studies, I've got the opportunity to introduce our speaker for today, Dr. Amit Verma, an Associate Staff Physician in Anesthesiology Institute at Cleveland Clinic, Abu Dhabi, qualified with M.B.B.S, M.B., M.D. in Anesthesia, a Fellow of Interventional Pain and Practice at World Institute of Pain, Miami, USA, having an experience of 17 years. These testing times of COVID-19 have posed the innumerable and unforeseen present as well as future challenges for the entire world. The most sensitive amongst all of us are the students who were ready and prepared to explore the world around them. With a wish to address pertinent health issues, we intend to organize an open session on the topic Health Now and Always, focusing on importance of health, maintaining proper lifestyle, and ways to achieve the same. It's an honor for us to have him today to conduct an online session on health, focusing on mental issues and ergonomics, in which he would be talking about adjusting workstation to prevent chronic pain. Before the session gets started, I urge all the viewers to pay attention as you are allowed to get a chance to ask your queries in the comment section below. With this, I would like to welcome our speaker for today, Dr. Amit Verma, to start the session. Welcome, sir. The platform is yours for the session to get started.
Okay. All right. So here we are, health now and always. This was a topic which we thought of doing, but then how do you keep your health? How do you stay healthy now and always? That's by preventing. Prevention is better than cure. The old dictum still remains true, and it always will remain true. So I am Dr. Amit here. I am basically associate staff physician in the Cleveland Clinic, Abu Dhabi. That's a small picture of the hospital where I work in. And I am basically an anesthesiologist. This is how I started my career, and then slowly I moved on to pain management, chronic pain management. I don't do much of anesthesia now, but I see patients who have pain more than 6 months, and it's not getting better. So we help the patients to analyze the pain and then see how we can help them in getting rid of it. And what I have noticed is most of the time the patients, it's all related to small habits which we pick up throughout our lifestyle and we never thought that they're wrong. And that is why I feel that this is a very important topic for you people to know. So the I will come to the aims and objectives later. So let's just talk a little bit about disclaimers. This is just to declare that I have no financial or academic benefits from this presentation. This is just, I just feel like speaking and teaching and giving you the knowledge. So that is why I'm here. I hope I'll be able to help you guys improve some habits and prevent posture related disorders. And a lot of opinions here which I present are my own, which are collected and are basically mixture of my experience and the knowledge I have gained. So please learn, prevent, and do not treat yourself. But if you have issues, make sure that you go and get experts evaluation. I want to thank and I appreciate the efforts of Virendra Swaroop Institute and Educational Foundation in the good work they are doing for the society. And I want to thank my sister Mamta Verma, who got in touch with me and gave me a chance to share my knowledge. So, what are we looking at? We are aiming to understand the word ergonomics. We are aiming to see what is the importance of this in the prevention of posture related disorders. uh, I'm going to be telling you some names of some common medical diseases so that when you know, if you remember it, you might be able to prevent some of the diseases because what you know, I mean, you can prevent that. And applying correct ergonomics in your lifestyle and stay healthy and young as much as possible. So, we are here, healthy now and always. Coming to ergonomics, what exactly ergonomics means? As in medicine, most of the words are basically derived from Latin and Greek language. So, ergo basically means work, and nomics means rules or laws of. So, literally, it means laws of work or rules of work. But going by the most non-medical terminology in the Oxford Dictionary, it is basically the study of working conditions, especially design of equipment. It could be furniture in order to help people work more efficiently. So what does it do? It makes your job easier, it makes your job safer, it makes your job more pleasant. If you're not comfortable sitting, you won't be able to do your job efficiently. And again, it saves a lot of money by avoiding to go to the hospital and doctors. Where all can we apply it? So now you know what ergonomics is. Now, what does it mean? How do we apply it? In simple terms, it can be applied in anywhere. It can be applied in office. So you have ergonomics for office. You have ergonomics for school. There are a lot of documents about school, and there are even kitchen and home ergonomics. The big companies or the construction companies, when they are making kitchen, they are trying to make sure that they utilize the practical aspects and the theoretical aspects to make sure that the working inside the home and kitchen is much comfortable for the wife, for the home ministry. So now you know where all we can apply it. I'm going to basically talk about the three aspects, but since all of you are related, I mean, not yes, all of you are in computer science. We'll be talking a lot about office ergonomics. I will briefly mention a little bit about school ergonomics because I know there are a lot of mothers here who would like to know a little bit about what they can do to prevent issues coming up in the future in their children, and a little bit mention of the kitchen ergonomics because I'm not really expert in that. So we can have ergonomic factors can be two, indirect or direct. uh, let's see, indirect factors you can also call as environmental factors. uh, so if you are in office and the lighting is not good, the visibility is not good, that's again ergonomic. So you have to make sure that the lighting is enough, your ventilation should be good, the sound should not be too much, which disturbs you, so you should not have noise pollution. And also we should have a calm and pleasant atmosphere. But this is not my focus for today because this comes, I mean, this again is going to go really into too much of detail. But yes, I am mentioning these because make sure that these four VVSE, visibility, ventilation, sound, and emotional aspects are comfortable. And it's not only for you, even for your colleagues. Just make sure that as much as you can help each other and support them, that makes the emotional aspect of the environmental factors. So you take care of that, and your working atmosphere will be much better. But indirect, yeah. So what are the examples of indirect? Excessive noise, as I told you, improper lighting, extremes of temperature, and all these result into a disease called sick building syndrome. If your AC is not good, it's not ventilating well, if your light is not good, if you can result in headaches. So again, I'm not focusing on this today. This is what I'm trying to focus on. This is where medicine comes in, and that is what I do. So what are the direct factors? We will talk about the direct factors, but what do? They basically put a lot of pressure on your joints, on your muscles, on your nerves, tendons, and bones. I hope you are familiar with these terms. I'm pretty sure no, but everybody knows. For tendons is something which can, I mean, might not be known. So tendon are basically small fibrous structures which connect your muscles to your bones, and they have very high chance of getting injured, and especially if you are in abnormal position. So if the pressure is a lot on tendons, you can have diseases of tendons, and they are very difficult to treat. And these injuries totally are called as cumulative trauma disorders or repetitive strain injuries. So you can understand it's very much simple in terms cumulative trauma and disorders. So what does exactly it mean? um, So there are micro traumas which accumulate over a period of time due to repeated actions. It affects a large number of population. That's what I see in the clinic. It results in physical ailments or abnormal conditions, right? So basically, it's a micro trauma which accumulates over a period of time. So today you are in sitting in abnormal position. You say, no, it's okay. I am fit today. I'm 25 years old, 30 years. I'm still fit today. I can take the trauma. But then over a period of time, when it accumulates, it results in pain. It results in irreparable damages, which can result in pain almost all the life also. So this is why it is called as cumulative trauma disorders. Today you might not, it might not be painful, but it might become later. So what all can it do? It can cause back pain, it can cause neck pain, it can cause muscle pain, joint pain, it can result in swelling, it can result in numbness. Numbness is basically when you start losing sensations, you're not able to feel things, and also it can result in the restricted motions. So let us talk a little bit more about some names. Why I'm talking about these names is because it is very common, if not very common, common among the people who are basically computer software or hardware workers. So carpal tunnel syndrome, I'm going to talk about that just now. There's something called epicondylitis. They're also called as golfers or tennis elbows. Something called tenosynovitis. Tenosynovitis is the inflammation of tendon or swelling or injury of the tendon, which I was talking about a little bit earlier. Or bursitis. Bursitis basically means swelling of the bursas, and bursas are small cushions which are in most of your joints. So they are between your muscles and your bone parts, so that when your muscle is moving close to a bone, this bursa takes over as a cushion, so it doesn't so the muscle stays healthy a lot of times. But when you sit in an abnormal position and compress this bursa between your bone and the muscle, the bursa gets injured, and then what happens? You have something called bursitis, or something called disc prolapse. What is disc prolapse? I think people know. Everybody relates the back pain to disc. I will going to give you a little bit of visual explanation about these things. So this is what is carpal tunnel syndrome. Okay, it's pretty common. Some of you might have known somebody around you who has suffered it. So basically what happens is that you see that black mark around the yellow nerve. When that nerve gets pressurized there repeatedly, the tissues around the nerve can swell up and compress the nerve and cause pain in your hand. So you will know why I'm telling you this when you look into the next slides, right? Bursitis, this is what exactly I was telling. So you look at the lower part of the bone, there's something reddish, that is a bursa. which protects your elbow. But if you keep your elbow, tip of your elbow, on a hard surface for a long time, so for a while this bursa can take over, but take the stress. But if it is continuously present, being pressurized, and the micro trauma which developed today uh, is not allowed to heal, this will accumulate over a period of time and cause swelling of the joints and something called bursitis. So this golfer's elbow is a disease which was very common in people who play golf, because they play very rapid shots, and it causes pain on the inside part of your elbow. Again, it was earlier common only in golf, people who were playing golf. That's why the name is golfer. But now, if students, or if even me, now we have a lot of documentation on computer. So we are actually seeing the patient and then we're writing almost everything in the computer. So if I do not place my elbows properly and I continue to press the inside part of my elbow, it can result in inflammation and cause pain in my inside part of the elbow. Similarly, very much similar is the outside of the part of the elbow. The bone on the outside part of the elbow also can become painful, and that's called tennis elbow. You can have tendon injury, displaced the where in the picture, where the thumb is being pressed. There is a small tendon there, and when that tendon gets injured, it results in a painful situation there. And it's very common among the new mothers who have been holding their baby with just one hand, and they're holding it in such a way that the tendon around that place gets compressed between the bone, and it causes pain. Again, this is sort of a bursa, which I was talking earlier. So this bursa can get compressed between the bone and cause you hip pain, and this is where the disc prolapse can happen. If your posture is not good, if you lift weights in the wrong position, you can have diseases like disc prolapse. We will briefly mention about those things and how to prevent them. So now you know a little bit about what sort of diseases can happen, and now we will talk about what are the risk factors for this. The most important risk factor is repetition. If even small injury is happening every day, it will result in diseases. So repetitive movements in bad positions, awkward positions, or postures, or continuous excessive pressure on any part of your body, or if you are doing any abnormal movement. So we will one by one talk about what are abnormal postures and how do you correct that, how you can avoid putting a lot of pressure on any part of your body, and how do you correct your movements. So this is an image. Everybody is taught how should you sit in front of the computer. So this is how you're supposed to sit, but after a while you see children how they're sitting, this is how they sit. Pretty similar. You start sitting in that way, and within few minutes you are sitting in another way. And this is a new disease coming up. It's called text neck syndrome. You have a habit and you continue to do it, and then it becomes your posture. So if you maintain the wrong posture all the time, you will develop diseases. If not now, later. So think of it, what went wrong? This is how we were earlier. We grew up to stand erect. We grew up to be much more straighter and healthier. But slowly, our software is affecting our hardware. So computer software is practically affecting our body's hardware. So again, what's going wrong? It's called sitting disease. We are practically sitting approximately 7.7 hours in a day, which is too much. Either you are sitting in your computer, or you're sitting in your car, again when you're driving back, and then you are sitting in your home, on your sofa. And again, just to mention this sofa, if you the more comfortable a sofa looks like, the more bad it is for your spine. So firm chairs were much better than really nice couches which go inside and make you, I mean, they absorb you inside themselves and give you such a abnormal position that it's very nice to go inside them, but within half an hour you will feel something is not right. So what are the examples of awkward position? When you're sitting and you're leaning forward towards your desk. So you should not be leaning forward towards your desk. Typing with wrists at an odd angle. I'm going to show you the picture so that you can understand. Raising shoulders while typing. So your shoulders should not be raised, because what will happen is your muscles will be continuously active to lift them and then they will result in sort of a muscle pain. So I will talk about what is the right position. You should not be reaching out for your mouse. Your mouse should be very much close to you, so that you don't have to do extra efforts. It should all be in such a way that you have all those things close by. And again, you should be looking straight towards the monitor and not twisting your neck. Few minutes is not a problem, but when you do this repeatedly, that is when the diseases accumulate and then cause a long lasting pain. Again, if you are regularly lifting objects below your waist or above the shoulder, that's again abnormal position. And 1 day or 2 day or 3 days or even a month might not be a problem in a young, healthy, very well developed person, but it can over a period of time result in diseases. So back pain is not a joke. If you want to avoid this posture when you are 70 or 80 years, follow the right practices. So we talked about what are the abnormal postures. Now we will talk about what are repetitions. When you're writing or typing some things, you're actually on a day typing at least thousands of keystrokes. Okay. If you are filing some things, your hours and hours, people in post office or people in the medical records or any other record keeping department are filing thousands and thousands of files. People are stamping dozens of papers. People are lifting things frequently. Repetitive motions with your computer mouse. Regular use of drill machines. So these are the examples of repetitions. When you're continuously repeating, these are the I mean, if you can relate to the professions where so this is like occupational disease, where you are not able to stay away from this repetitive movement. And that is why you should acquire a better posture and position so that you can avoid diseases. Again, if you have an abnormal gait, we will talk a little bit about normal gait. So if you have an abnormal gait, you're putting a lot of pressure on any of your joints. Might not hurt earlier, but then later when the body is not able to heal, then these things result in chronic pain. Examples of excessive force: when you're typing and hitting each and every key with a lot of force. Stamping, as I said, that's hitting too hard. Or if you have to lift boxes of paper or carrying office equipments inside the office regularly and in abnormal posture, or sometimes you're trying to lift weights which are beyond your capability, so that is what is excessive force. Or if you're not using proper grip to lift the heavy objects. So we will also talk about how to lift heavy objects. But all this was bad news. Don't worry, you have good news coming, and there are very, very simple ways to help yourself. First and most important, learn from your mothers who know how to organize things. Okay, whatever is, never learn from your fathers. I don't think fathers are as organized as mothers. So uh, make sure that when you're organizing your table, when you're sitting on your office desk or your study table, whatever is more important to you just stays around you. So usual work is as close to you as possible. Occasional work goes a little away from you. And non-working area is the red area where you keep things which are very, very, very infrequently utilized. So you keep these things organized in 3 layers. And just picturize this thing and remember this image. Workstation ergonomics, and this is what the whole presentation is practically about. Make sure that you are sitting on a chair which if it is not adjustable, you should make sure that it is not too high or too low. What do you mean by too high or too low? Your hip And since you're computer engineers or computer students, I'm pretty sure you know about angles. So you should make sure that your body, the spine, and the thigh bone are at an angle between 90 to 120 degrees. So you're not neither are you in a very small chair or a low height chair that your knees are bent too much up, nor very high that your legs are falling too much down. You have to make sure that your knees, there is a little gap between your knee and your table chair seat, and your knee should not be pressing on the edge of the chair. Then going to the backrest, you should make sure that your backrest is supporting your lower back. Chairs which do not have a backrest are usually not the best ones, because they make you slouch, they make you go into that gap, and so we don't recommend that. Your back should be straight. One of the best ways to describe, which is what I describe to the patients, is that make sure that your ear, your shoulder, and your hip joint, they are all in the same line. This is the best posture. So everybody slouches a little bit on and off, but if when you're sitting, whenever your body calls, you sit straight and make sure that your ears, elbows, and the hip joint are in the same line. Now, how do you adjust your computer screen towards with you? So make sure that your monitor is roughly an arm's length away and you're looking right into the monitor, neither looking up nor looking down. uh, there's one more thing about flat feet on the ground. So your feet should be comfortably on the ground. If you're not comfortable with it, you can also use footstool so that your angle, as I said, between 90 to 120 degree is maintained. So we talked about the picture. Let us again look into each and every aspect. As I said earlier, elbows should be at a comfortable angle while hanging at the sides from the shoulder. So it should be relaxed and hanging. The shoulders should remain relaxed in a lower position while typing. So shoulders should not be lifted, shoulders should not be pushed down. They should be just relaxed around the body, and you should have around 90 to 120 degrees of angle at your elbow. So avoid leaning forward, maintain your spine's natural curve. Again, as I said, the easiest way to remember is your ear, your shoulder, and your hip joints, they are on the same line. When you do that, you're almost making sure that your spine is in natural curve. Again, support your lower back, so your chair should have the backrest which is complete from top to bottom, so that your lower back is supported. And if required, you can use a footrest so that your knees are at a proper angle and your hip joint is also at a proper angle. This is what I was talking about, correct and correct position of the wrist. When you're typing, avoid typing with wrists at an odd angle. So you can see in the image how on the left side the person's hand is twisted at the wrist, but on the other one it is straight. So this angle should always be straight. You should make sure that the home key rows are somewhere very close to your elbow, so that height is the best. Do not try to so look at the first image, the top picture. Incorrect position, your wrist is bending back a lot. It should not be bending back too much, because that is when it can compress the nerve. Your wrist should be very much straight and a little above the floor, I mean above the desk surface, and then the fingers must be doing the work. So again, keep them in neutral position, not bent up or down or side to side. The keyboard should be slightly lower than your normal desk. That's why our computer tables or computer desks have the keyboard below the desk. But if it is not, don't worry, you can just have a higher chair, and that should be okay, no problem. And as I said, keep home rows of the keys at the elbow level. And if your if your table is not perfect, make sure that you have an adjustable chair and you adjust the height as much as you require to make sure that the angles are perfect. Again, prevention strategies. Do not press too hard on the keys. Use a light touch. Do not push them. Do not push them hard. Some of the, typing instructions. If you want to use Control or Alt, use from two hands. Do not twist your hand regularly to operate Control C. So if you want to, if you're working You can push your control or shift or alt with your right hand and press C with the left hand, or vice versa. Position frequently used equipment so that you don't have to reach for it. This is what I said in the layout plan. Whatever is important, whatever you think is going to be useful, just have it around you, and then uncommonly used equipments a little farther from you. Place monitor in front of you and not at an angle. We looked at it through the image. I mean, if you think that you're getting tired, your body is hurting, relax, close your eyes, look around, make sure that you relax a little bit frequently. Do not hold the mouse very tight, hold it lightly, and keep your hands and arms warm. And again, this is also very, very important. If your neck is hurting, if your back is hurting, this is more of a warning sign. So whenever your pain is starting, the body gives you warning sign all the time. So if your neck is hurting, examine your body. Remember what I said of ear, shoulder, and hip. So position yourself in the right way. And if you think that you need to take a break, just stand up from the chair, do a little stretches, and then get back to work. And this should not distract you from your work as such. But whenever a pain comes in while you are sitting or standing, it is always a warning sign that something was wrong in the way you positioned yourself. So make sure that you do not do that or change your position. So this was about the body pain. What about headaches? A lot of office related headaches are caused by dry eyes, monitor glare, or eyes getting tired because of continuous looking onto the screen. So what do? You position the monitor at a comfortable distance, as I talked about, adjust the brightness and contrast, make sure that your screen is clean, and make sure that if you feel your body is calling out that something is not right, close your eyes, roll your eyes inside, look around a little bit. I mean, turn your neck around a little bit and get back to work. And this can be repeated frequently. There is nothing wrong with it, and that's what we do. A lot of times we've been doing that. But yes, what I'm talking about today is just to remind you that whatever we have been doing about this is correct. So carpal tunnel syndrome, this is what I was telling a little earlier, is not uncommon. It's very much common in computer operators, and it's a condition where the nerve gets pinched. And I showed you in the smaller image, the same image earlier. And when that gets pinched, it causes tingling. That means you feel something like pins and needles in your hand, and also it's painful. So, and how do you prevent carpal tunnel syndrome? Very much depicted in the picture. You see how on the left side is a wrong method, on the right side is the correct method. Make sure that your wrist is neither too much up nor too much low, and it is very much in line. Um, I personally advise the gel padded mouse pads, so that your wrist is resting on a very soft place. Because if your mouse pad is not good, I'm pretty sure it's not a long time from now that you will start developing carpal tunnel or a wrist pain. So, looking at the wrist again, either it should not be either bent too much back or front. Neither should it be bent on the right or left side. It should be very much neutral in position. Coming a little bit about back pain. So we talked about positioning, and how we should be sitting. Then I talked to you about carpal tunnel, which is not uncommon in computer operators. And then coming to the back pain, because these are the two most common issues which happen. Uh, these are the most common ways of presentation of pain because of posture related abnormalities. So, why should I talk about back pain? Just imagine the left side is a picture of your spine. I mean, I have taken this picture from the internet, but it's just trying to show you how your spine is organized. You have the white part are your vertebrae, the yellow part are your nerves, and the red part is your disc. So it's like a representation of your spine. Okay, it's not exactly spine. This is so why I've taken this picture is because I want you to imagine the ball between the two vertebrae as your disc. And this disc is basically is designed in our body to take the load of the impact, and also impacts of walking, and also impact of weight bearing. So if you lift 20 kgs on your right hand, 20 kgs in your left hand, you not only are putting your hands and shoulders on stress, but you're also adding 40 kgs of weight on your spine. Now, if your spine's curvature is normal, as I talked about, making sure your back is straight, uh, it is supported by the joints which are on the back part. So the round part you see on the image are your bodies of the vertebrae, and the back part with the sharper on the left side of the image are called the spines, and between the two vertebrae you have a little joint. So if your spine is straight enough, your joints will also take the load of the weight which you are lifting in your hands. But if you bend forward, as I am showing on the right picture, when you bend forward and lift the weight, what happens now is that your joints are not at all taking the load. The load totally goes to your disc, which is on the front part, and then it pushes back. And when does happen, we call it disc prolapse. Um, Unfortunately, I didn't put that image here. Um, but this is what happens in the disc prolapse. The front part gets compressed when you are sitting or lifting any heavy weight with your back, and then it goes back towards the nerves and it causes back pain. It causes a disease called sciatica in the common terms. So that is the reason why you should make sure that your spine is not bent forward. So look in the left picture. The left picture, the spine is curved. It's like bent forward. The spine is curved like a C, and it is. I mean, if you can imagine it, it is pushing the pressure, putting a pressure on the front side of your disc, and that is how it can result in back pain. But in the right side picture, you see how a person is standing straight and sitting straight, and when he's sitting straight, the load is not only on your disc, it goes back to your joints also. So the weight is distributed and it doesn't result in any problem. Again, more about back. On the right side, you have an incorrect image. I am just trying to talk about this and this segment because you just saw the image of the disc, and you can schematic image and you can imagine it. On the right side, if you look at the person, he's bending forward and then lifting up. What happens is that this way is that his back is doing the real work, and we do not want our back to lift weights. Our back is not made to lift any weight. Our arms and legs are supposed to lift weight. So you look on the left side of the picture. This person bends down, keeping his back straight, lifts the object and stands up. So this is how you protect your back, and this is a very very important practice which should be imparted into the children at a very younger age, so that they do not damage their back. So when you are going to lift a weight, what should you do? If you have like 10 kgs, also it doesn't matter, 10 20 kgs, by chance you land up lifting a weight, you go to close to the weight, think, then position your feet around the weight, then stoop down. Do not stoop down, sit down, adopt a good posture, hold the weight with your hands, then use your legs to stand up, keeping your back straight. And you have to keep the load closer to your body. If you're farther from the body, again your back is going to do the lot of work. Do not do any jerky movements, slowly lift up. If you do jerky movements, it takes a toll on your joints and your muscles and also your disc. Lift the object and go closer to wherever you want to go, put it, and place it on a higher surface. If you want to put it on a floor, you will have to do the same process in the reverse way. If you can't do that, you can always do this posture, making sure that your back is straight. So smaller objects also, you should never bend your back forward, so don't curve it. Just make sure that your joints are doing the work instead of your back. When you have to reach overhead, when you have to go up, as I said earlier, once in a while is not a problem, but the weight should not be too much. But if you have to do something repeatedly, you have to make sure that you have a safe platform or a step stool which you utilize to go up and put the object not the way it is shown on the right side of the picture. So once in a while is okay, but when you do repeatedly, it causes cumulative trauma disorders. So what is a good posture? Look on the left or look on the right. You can obviously make out that left side is correct. And as I said earlier, make sure that your ear, your shoulder, and your hip are all in the same line. You can even include your knee into that. A little bit again about the correct posture and incorrect posture in different scenarios. When you are trying to do sit-ups, make sure that your back is not bending like a C. It should be straight. When you're sitting on the desk, make sure your back is not in the C shape. So just remember, C is not good. It is the straight S which is good. And our spine, which starts with S, is actually a little bit S shaped curved. So this is the new disease which has started in few years. We call it text neck syndrome now. See, this is what happens. The weight of your head is approximately 10 to 12 pounds. All right. Now this is at 0 degree. When your neck is straight, your ears are close to your shoulder. I mean, your ear and the shoulder are in the same line. The moment you bend your head 15 degrees forward, what happens? Instead of the 10 to 12 pounds of weight of your head, it it increases to a pressure load of 27 pounds to your discs. And again, when you increase this angle further, the weight on the disc is equivalent to a 40 pounds, and this increases to worst 60 pounds. So approximately 5 to 6 times more than what it should be in the normal position. Our grandfathers and fathers did not have much of issue with the neck then than what we have now, because we didn't have cell phone. And if you just imagine, the right side image of this slide is what you see around most of the time, and they all might not tell you that they have neck pain, but they come to me when they have the neck pain. So make sure your posture is the one on the left side of the slide, then on the right side of the slide. And that is how you can prevent your neck pain. Coming to the gait. What is a gait? I mean, for us, we never notice exactly. I mean, even for me, till we really started studying about the abnormalities of the gait which can happen, we never bother what exactly gait involves. And we have people who are actually specialized in gait training. They analyze the gait and then tell us what is right, what is wrong. But gait exactly is what? Is the way you move. So gait involves displacement of your body in a desired direction, utilizing a coordinated effort between your joints and muscles of the trunk and also legs. Now, any abnormalities in this coordination can result in abnormal gait. So abnormal walking, let us put it in more simpler terms, abnormal walking. And so if you have left side hip joint pain, it is going to interfere with your gait definitely. And what will happen over a period of time with this abnormal gait, your left, which was already bad, it will it that the pain of the left will, you will try to adjust your weight on the right side a little more, and it all depends on different people. They might land up putting too much strain on the ankle joint or on the knee joint instead of the left hip, and over a period of this repeated abnormal gait, the trauma will accumulate and start causing pain in the right knee and the right ankle also. So now you have hip pain and ankle pain. So make sure that your gait is correct. Did you ever notice that so many stances or so many phases are there in your gait? When you're walking, your heel strikes the first, then your foot takes the load, then your forefoot starts taking the load, and then it's like a terminal stance when your foot is coming off, and then it just pre-swing, and then you take away your toe. So around 60% of the time, okay, I'm going to finish it soon. So it's 60% of the time you're actually putting a load, and 40% of the time you don't have much of load. So make sure, what I say is that think like a cat. You always see them how they are uh, putting a lot of weight on the forefoot, and so forefoot is what you should be utilizing more than putting a lot on the heels. The impact is borne much better by the forefoot than on the heels. Little bit image about the key kitchen ergonomics. You should make sure that you have enough space around you. Look around, so there are proper experts to make sure that you have good kitchen ergonomics, and that does not result in back pain. If you want, you can use your footstools or sitting stools and utilize that. This is almost finishing now. I just want to mention a little bit about ergonomics in children. Children's ability is often overestimated, and our posture develops by the age of 7. So if we do not teach the children what is right, what is wrong, and how they should be sitting, they might never learn. I was surprised to see that the correct posture techniques were taught by I mean, in my son's school, which is a CBSE board. I think in fourth grade, in the fourth grade, they were taught how to sit straight and how to walk, and which is very, very nice. So even though they were taught, they still keeps moving away from the standards, and we should try to bring them back to the track. So, I mean, not going into too much details of the numbers, but on a guideline basis, that we should not have a child with more than 50% of his weight into the okay, please don't forget. Okay, okay. So a child should not have more than 50% of his weight into the backpack. A simple practice for the school bags: make sure, so I mean, so they are the best practices for the school bag. Make sure that your shoulder straps are padded. Choose a school bag with a waist belt, so that a lot of weight is not on the shoulders. It is distributed within the between the shoulders and the waist. They should not carry more than 50% of their body weight. So heaviest items should be closest to the child's back. Otherwise, they are gonna go back, and choose backpacks with several compartments. If you can have a bag with wheels, that's better. Always wear both shoulder straps, and don't hang your bag on one side. Adjust shoulder straps so that bag is snugly fit. I hope it was worth your time. Um, just to conclude, make sure that you stand and sit erect. You exercise regularly. Stay safe, and don't forget your mask when you step out of the house in this COVID time. Thank you. I hope it was worth your time. I'm going to close my PowerPoint, and I'll be looking at the questions. All right. So, people, I'm not sure how long we have, but I'm not sure if it was helpful. I tried to make it as simple as possible. Yeah. So, I'm ready for your questions. So, let us go one by one. Mamta is asking me, is sciatica pain due to bad posture? Okay. So let us go one by one. So I have first question, which is sciatica is due to bad posture. Uh, there are so many issues which can result into diseases, right? There's so much of lag in what I'm speaking. So sciatica basically means that when you have a back pain, uh, you have a back pain and it runs down your leg like a current. Okay, and that happens most of the time when one of your nerves in your back, which gets touched by anything. It could be your disc, it could be a bone, it could be anything. Some people even have tumors. So sciatica as a term is basically for the pain which goes from your back down to your leg. Bad posture can worsen it and make it more bad. So if you feel back pain, remember that uh, it's a calling by your body that you have to stand straight, make sure your posture is correct. So if you correct your posture, you can prevent the worsening of sciatica for sure. Okay, but now sciatica is because of bad posture? Always no, we can't say that. But bad posture over a period of time can result in sciatica. Any more questions? Yes, Shweta, if you stand for a long time, it can not even result in back pain, it can result in leg pain. But w- but what the best thing you can do is that make sure, as I said, that you are standing in the right posture. Make sure that your hips are balanced. You're not standing on one of your joints. Make sure that your y- your hip joints is the same level. Your your ankle, your knees, and your hip joints are all in the same line. A lot of times you will see that the people are like tilting their hip on one side and standing or on the other side. So for a few minutes is okay, but if you have developed a habit of standing in that posture, it will continue to cause pain. So what else can be done? Continuing to have one posture is one. Continuing to stand in a good posture is one, and another thing is to move around. Move around. Uh, every 15 minutes, you definitely should move around a little bit. At least stretch back, left side, front side, and learn some exercises. There are so many. Tomorrow, I guess, is a yoga day, and yoga is. I myself, I consider myself a very much fitness enthusiast, and I love to exercise. I love to run. I go to the gym once in a while whenever I have time. But running, I love because it doesn't need much of preparation. I need to just warm up for a few minutes and I get going, and then again I warm up. Stretch after my running. But running is only one part of exercise. Yoga is awesome. Yoga not only strengthens your muscles, yoga stretches your muscles. Yoga learns you to makes you learn good posture, and I think it's as Dr. Prime Minister Modi said, it is the gift by India to the world, and we should try to inculcate small habits. Do some exercise at least 15 to 20 minutes. If you what normally if you go on YouTube and you learn some basic lower back strengthening exercises and stretching exercises, you can learn them, and you actually need maximum 15 minutes per day to, and a routine doing of those exercises per day to avoid your back pain worsening or even to prevent the back pain. You can just wake up in the morning and start the exercises in any of the mats or yoga mat. Do 15 minutes, that's all, nothing more than that, in the morning or and before you sleep, and that is going to keep your back straight and healthy. So I talked about the back pain. Somebody asked about shoulder pain. Yes, shoulder pain can result not only from bad posture but also bad use of shoulder. So if you're using your shoulder, okay, let me see. So what could be the reason for shoulder pain along with neck pain? How can it be cured? So I'm sorry. I mean, to really, I can only tell you that shoulder pain can result in if you are using your shoulder wrongly, you can have neck pain and shoulder pain. And again, there are so many structures around your neck. Some of them are simple. Uh, okay, so I'm going to take the shoulder pain question and the mental health question. Where is one more question here? So we talked about, so just let me see what is happening. Too many questions. Maybe the question is somewhere off topic, but I want to ask, what are your views regarding introduction of data science, machine learning, and deep learning in medical science domain? Okay, so let us, yeah, so this is one question. So shoulder, medical science domain, and the mental health. Mental health. All right. So one by one, as I was talking about shoulder again, shoulder. If it's very difficult to say one reason for pain, why shoulder pain is, and that's what we do. You go to a specialist who analyzes your shoulder and then tells you what is the reason behind it. And to me, 90% of my patients will get better if they avoid harming the shoulder by abnormal usage of the shoulder joint. So instead of using your biceps to lift a weight, if you try to use your shoulder or deltoid muscles all the time, if you're sitting in the car, drive on the driver's seat, and somebody asks, or your wife or your children ask you to pick up something from the back of the car, you stretch back, you stretch your hand too much, and you try to lift 6 to 7 kgs of weight with your shoulder. What will happen? Your shoulder is being stretched out of the comfort zone, and you're lifting the weight, and then you're bringing it forward, and then you hurt it already now. So this is what one of the prime examples of how you can affect your shoulder joint. So it is one of the reasons of shoulder joint pain. But shoulder joint and neck pain, when neck pain going to the shoulder joint, is a complex thing. If you have severe pain, go to an expert and get advice. Being so far from you, I really don't want to give any advice on the treatment part, which will not be the right for me to do. But I told you my aim was basically to teach you how you can prevent these things. But to analyze what is happening right now with you will not be the right thing to do. Coming to the medical science domain and introduction of machine learning and deep learning, data science, yes, so we are actually utilizing a lot of data which we pick up after we discuss the symptoms from the patients, because now even the symptoms are stored in the computer. We don't write them on the paper. We are almost paperless hospital. Every medical complaint is clicked in the system, and it stays as a data. And people are really working hard to see if we can make softwares in which we can a person can click on the symptoms he has and come to a diagnosis, and that's how we call Google doctors. So Google is trying to help you to diagnose. uh, it is good up to a level, because it can help you to it can alert you actually that there might be something wrong, and maybe you should go and check. But the human body is so complex that you can have flu which can be causing you headache, you can have flu causing you back pain, and you can have posture related diseases which is causing you back pain. So if you say that I will take back pain and it will give me diagnosis of flu, or you have fever, you have back pain, it could be 5 to 6 diseases. So a proper examination after history taking has importance. So that is why I says that you can search on Google medical science. The what is it called? Machine learning has a big role in medical science, and we have robotic surgeries going on, which are basically machines doing the surgical work with the assistance of a surgeon, or you can say surgeon doing the surgery with the assistance of a robot. So machine learning has a big role to play, and within 10-15 years it will have much more bigger role to play. And if you are interested in it, you should work on it. And there's a lot of potential for it. So we talked about the medical science and artificial learning. I can say this is the best description I can give it. Now we have Yash. Now it's already have been a long time. We have been sitting in wrong position, and and now if we try to correct the process, it becomes restless. So how long will it take to get rid of it? So if you are sitting in the right posture, you can definitely sit for half an hour. And if you think that your pain has started after sitting in the right posture, also make sure that you if you were in the right posture, your ergonomics were right or no. If your table was not too far from you, so, uh, and getting pain even after sitting in normal position is not uncommon. You just have to stretch a little bit yourself. Again, I don't want to be teaching you exercises because I do that when I've examined a person and I know which stretching can be best for him. But I don't want to really talk about the treatment part at this point, and I'm pretty sure you understand that. So now we are coming to mental health. This Sushant Singh Rajput has really raised a big question about mental health, but he's not the only one. Huh? I'm pretty sure you must have followed. If I mean, all of us follow Bollywood, and it is a few years back. Even Deepika Padukone declared that she went through depression. Guru Dutt committed suicide because of depression, and they are not the only one. There are enough people around us who are suffering. There are enough people around us who are suffering. Now, how do we stay mentally fit? Very, very complex, but uh, uh, easiest to say is you have help around. How do you protect yourself? You just make sure that you have people to talk to yourself. How do I stay fit? I can talk to you about how do I stay mentally healthy. I'm pretty sure everybody has his own likings. There are few hobbies which you have and you love them. All of us have. There are people who like to sing, there are people who like to dance, there are people who like to play music, there are people who like to play video games, and that makes them happy, and there's nothing wrong with it. So make sure that you are giving, this is my, again, as I said, this is my opinion, and I don't want to take any uh, like responsibility for this, but this is how I do. I am a pain physician. I'm not a psychiatrist, and this is not a mental health awareness talk. But yes, I do understand it's very, very important. But how I do is I love what I do. I really like what I do, and it doesn't tire me at all. So I learn from children. They run throughout the day. They run whatever they do whatever they want. And you hardly see them tired by the end of the day. So if you love what you're doing, you should be healthy. So love what you do. Even if you are in a job where you don't like what you do and it is your necessity, you do it. Third thing, in throughout the day, you there must be some hobby, as I said earlier, which you love doing. I like to listen music, I like to exercise, I like to play table tennis, I like to do whatever, I like to do go to gym. Whatever you love, at least spend part of your day doing that, so that by the time you're sleeping you're happy that you did something good. That's one. Second is, uh, when you know the stories of people like Sushant Singh Rajput, you know the story of other celebrities who have committed suicides. You know what has they just they end their sufferings. But what did they do? They actually increase their family's suffering. They increase their family suffering. And if you know your family, if you love your family, I think the best thing to do is talk to your family, talk to your friends. There, I'm pretty sure all of us have enough people around us to whom we can talk, right? So talk to your friends, talk to your family. Remember, there's always somebody around you who needs you much more than you need yourself. And again, if you exercise, that's one of the best stress busters. Exercise releases hormones called endorphins in your body, and endorphins are the ones which make you happy. So it doesn't matter what exercise you do. You don't like to do exercise, also just push yourself, go for a walk, do yoga, uh, sweat for half an hour. And when you sweat for half an hour, you will fix your chronic pain problems and also mental health problems. I hope that answered. It's but mental health is such a big topic. It's very difficult to really explain, but I've tried to explain it in my way. Now I'm going to, what do we do when we have pain which arises due to exercises? Go and get it checked. You have heel pain, go and get it checked, because you might be calling it heel, I might be calling it ankle, somebody else might be calling it tip of your toes. So again, for me, if you have issues, please get it checked. Don't get treated, but at least get it checked. Question your doctors, ask them what is the reason why your pain is there, and if you're satisfied, then you take the treatment. So don't ignore it. But does wearing high heels lead to back problems and bad posture? Yes, unfortunately, yes. So, cumulative trauma disorders, and that is what we were talking about. If you have high heels, I mean, little bit is okay, but regularly high heels does put pressure on the ankle, and so it leads to ankle pain. But again, I have never worn heels. My wife doesn't wear heels, and I really can't say much about it. But yes, heel can result in problem, and if you have pain, you wear heels. It doesn't mean that it is always only because of heels. It might be something else which needs to be examined. So, if you have pain, please don't treat yourself. The motive of today's talk was to prevent the pain. But if you have pain, get it checked and then decide what you want to do. Any more questions? I think Purnima's question was the last question. So, can we say that we are done with the presentation? Uh, Anybody has any more questions? And if everybody is okay, then we can close the session. Looks like almost everybody has. Shriyapal, sir, why do itching in eyes occurs while waking up? I don't want to answer any ophthalmology questions. Sir, if head pain starts from eye in the middle of the head, again, as I said, if you have pain, please get it evaluated. We can talk about prevention of pain, but I cannot answer about treatment of pain. Heads, anything headaches, especially anything can result in headache. Your friends can give you headache, your wives can give you headache, your husbands can give you headache. So anything can result in headache. But what is the real reason of headache has to be evaluated. And if you have head pain starting from the eye to the middle of the head, it could be migraine, it could be anything else related to the eye. So please get it checked. And is gain in weight also a factor resulting in CTD? Yes, for sure. If your weight gain is very, very fast, then yes. What happened over it? Yeah. So if your weight gain is very fast, it can result in weight gain. I mean, it can result in back pain. So no doubts about it. Losing 5 kgs of weight can reduce the pressure over your joints by 50%. And I think we have like done with like 1 hour 20 minutes of this. So if you have any more questions regarding the prevention of pain, I think I can take that. But if you have any questions regarding treatment of pain, I can only advise you to see someone. So thank you, everybody. Thank you for listening, and thank you for your questions. When you ask questions, looks like I was able to impart something. And when the person writes CTD, I'm very happy that they remember this term. So remember CTD. Remember, don't start accumulating the small traumas in everyday life to result into a big problems. So thank you, and I will end the stream now. Hopefully, We will collaborate again later and try to be more helpful on more precise health topics. Take care, have a good day, stay safe, and don't forget your masks when you go out of the home.
Gratitude is the most exquisite form of courtesy. With this, on behalf of Dr. Viren Swarup Institute of Computer Studies, I deem it a great honor to propose the vote of thanks to our speaker, Dr. Amit Verma, for being with us today to share your findings, which would certainly help us in our life's journey. Thank you so much, sir.